welcome to our Monday Minute. Today, we're going to visit a topic that must be revisited every year, and that is Medicare open enrollment. During a period from October 15th through December 7th, your patients have the option to move out of traditional Medicare into a Medicare Advantage plan, to move from a Medicare Advantage plan to a different Medicare Advantage plan. And it is a very difficult time of year, not only for you as an agency who has patients that are making these decisions that could impact your payments. It's a very difficult time for your patients and patients' families as well, as they try to maneuver through the process and determine what they need to do for themselves or for their family members. It is very, very important that you are aware of the fact that open enrollment is occurring, that you are preparing your field staff to answer any questions that your patients might ask. There is nothing that says you as an agency can't speak to your patients about the care that they are receiving based on the payer that they might have. In other words, if a patient needs 10 therapy visits and the Medicare Advantage plan will only approve 6, there's nothing that says, in fact, you're probably required based on regulation to explain to the patient what's taking place and why they're only receiving 6 therapy visits. The reality is that many will make the decision to move to a Medicare Advantage plan or move to a different Medicare Advantage plan during this period of time. The new plan will go into effect January 1st of 2025. In many instances, it will not necessarily be updated in the system by January 1st, which means that you need to be having the conversations with your field staff, especially the ones that do admission visits, and ensure that they're having detailed conversations with your patients even now about them receiving new insurance cards in the mail or any letters that they receive regarding their payer, that they share those with you so that someone can ensure that the payment for their services is not interrupted beginning January 1st of next year. For both home health and hospice, it is very important that these conversations are had. The VBID demonstration for hospice will end December 31st of this year, and the patients will go back to traditional Medicare regardless of their payer in January, but you still want to be aware of the situation as a Medicare certified hospice. As you enter into 2025, home health agencies especially, you need to be very diligent about checking the patient's Medicare eligibility file, not only the ones that you are doing new admissions for, but all patients should be checked that first week of January and then at least weekly until we get through the first quarter of the year. Even after the end of the first quarter, your patients who are currently in Medicare Advantage plans will have the option at any point during the year to change to a 5-star Medicare Advantage plan. Even if they are currently enrolled in a 5-star plan, they have the option of moving to a new 5-star plan. So it is very, very important that eligibility is continuously checked within your systems. If your EMR system does not do these auto checks for you, then someone needs to be checking your patient's Medicare eligibility again weekly in the first quarter of next year, and at least once a month following that. Even if your patients are not due for their monthly eligibility check, when you move to monthly, you definitely need to make sure you're checking those if you are recertifying a patient, regardless of where they are in that time period. It's imperative that we understand if we do not have the correct payer and we are not obtaining authorizations when required, your payments will not occur with those particular payers. Also, as I have stated many times, you can receive an authorization for a patient who might not even currently be enrolled in that plan. So not only do you need to check the eligibility file, you need to verify the actual coverage with the Medicare Advantage plan in question to ensure the patient is still currently enrolled in that plan before you go through the authorization process, providing care and billing for the patient. I hope this has been extremely helpful today. Healthcare Provider Solutions is here to assist, whether it be with billing for your patients in traditional Medicare or Medicare Advantage, or whether it be with your managed care plans, negotiating rates, renegotiating rates, getting contracts established. We're here to assist with that as well. Thank you and have a fabulous week.